Communication within the sciences is important to acknowledge new information regarding medical, ethical, or even social issues. To ensure effective communication, there should be principles and regulations to follow. Here are some principles of scientific communication as stated by Subateru and Bosch. The first one is objectivity, which is to develop critical self-reflection, good and active listening, and to seek feedback from peers and the public. Next is honesty, which implies to be truthful, which is to avoid overstatements and deception. Next is openness, which is to reveal trial and error when one makes a mistake, whether it be the researcher or the participant. Constructive criticism with each other can help improve the scientific process. Next is accountability, which implies that researchers have an obligation to explain their work and justify the results and interpretation. Lastly is fairness, which implies to have clear and precise communication that does not discriminate and allows equal opportunities for participation. Ethical implications involving human subjects for research has been around for years. According to Huang et al., the research ethics committees and the institutional review boards were created to protect human rights and their privacy. The regulations also state that the researchers must apply for ethic reviews and obtain ethical approvals for their research involving human subjects. The human subjects involved must be aware of their informed consent and risks that they may face during the research. Communication within the healthcare field should align to the principles of autonomy, beneficence, non-maleficence, and justice. The following ethical principles were defined by Potsgar. Autonomy, which is when a person has a right to make his or her own decisions about healthcare. Healthcare professionals must respect the patient's wishes even if they refuse treatments that would be beneficial to their health. Next, beneficence, which is defined as doing good, showing kindness, and helping others. Healthcare professionals must ensure that their patients' healthcare plans or even their actions toward their patients and their families must be beneficial to them. Non-maleficence, which is the principle to avoid causing harm to others. This is the duty of healthcare professionals to ensure that their patients are healing, not deteriorating. Lastly, justice is defined as to be fair in the distribution of benefits and risks. This principle demands that persons, whether provider or patient, is treated equally. Communicating effectively and appropriately towards patients, their families, and other healthcare providers will exhibit professional qualities for yourself. This will also improve relationships by building trust and confidence with each other. As a future healthcare professional, I would not try to perform any service or promise to provide a service that would not be within my scope of practice. I would ensure to explain all situations, issues, or questions effectively and clearly. Before I end the conversation, I would make sure that the person or people I was speaking to understood the content. Any type of communication should be comprehensive, accurate, composed, and clear. When I would write formally, whether it would be through email or text message, I would guarantee to understand what I'm trying to achieve. I would ensure to sound professional rather than informal. I do keep it simple unless I am making a complaint. I get right to the point and focus on what I am trying to let the addressee know.